Use two sequences every time. A, B, C, D, E first, G, C, S consciousness next. That is the safest exam and clinical order. Dental emergency guidance recommends the A, B, C, D, E approach for assessing the acutely sick patient, treating life-threatening problems as they are found, calling for help early, and using the team efficiently. The Glasgow Coma scale is then used to objectively describe the impaired consciousness. Glasgow Coma scale made easy. GCS is just EVM. Eye opening is equal to 4, verbal response is equal to 5, motor response is equal to 6. So the total score runs from 3 to 15. The best exam way to remember it is eyes 4, voice 5, motor 6. Full scoring. Let's start with the eye first. 4 is equal to spontaneous, 3 is equal to command or voice, 2 is equal to pain, 1 is equal to none. Next, verbal. 5 is oriented, 4 is confused, 3 is inappropriate words, 2 is incomprehensible sounds, 1 is none. Motor. 6 obeys commands, 5 localizes pain, 4 withdraws from the pain, 3 abnormal flexion, 2 abnormal extension, 1 none. Severity shortcut. 13 to 15 mild, 9 to 12 moderate, 3 to 8 severe. Memory line. 13 good, 9 worries, and then emergency. Very high yield exam trap. Do not rely only on the total score. A patient should ideally be documented as E, V and M separately, and serial GCS assessments are more useful than one single reading. Fastest oral chant. Eyes 4, voice 5, motor 6. 13 to 15 mild, 9 to 12 moderate, 3 to 8 severe. That is enough to solve the MCQs of GCS. Next, chairside emergencies, the exam setter way. The common chairside emergencies repeatedly highlighted in dental practice guidance are syncope, hypoglycemia, angina or the chest pain, seizures, choking, asthma, anaphylaxis. Okay, let's get it going. First, know the master memory line. Faint, sugar, asthma, chest, fit, choking, allergy. That single line covers the major NEET style dental emergency questions. Next, the one algorithm for every chairside collapse. A, B, C, D, E. Airway, breathing, circulation, disability, exposure. Remember this, my dear friends. Treat life-threatening problems as you find them, reassess continuously, and call for emergency help early when needed. Disability shortcut. In a suddenly unwell dental patient, rapid consciousness assessment can begin with AVPU. Alert, response to voice, response to pain, unresponsive. Then, if needed, move to GCS for a more detailed score. Syncope made easy. This is a classic dental chair emergency. Think anxiety, pain, vagal overactivity, pallor, sweating, dizziness, brief loss of consciousness. Memory hook. Faint is equal to flat. Immediate treatment is to lay the patient flat, raise the chairs to improve the venous return. Guidance also notes oxygen may be given, and if the patient becomes unresponsive, you must check for signs of life. Next, hypoglycemia made easy. Think diabetic patient, sweating, trembling, headache, confusion, slurred speech, aggression, seizure, unconsciousness in severe cases. Memory hook. Low sugar is equal to sweaty, shaky, silly. If glucose is low or hypoglycemia is suspected, conscious and safe to swallow. Give oral or buccal glucose. Impaired consciousness, cannot swallow safely. Give glucagon, intramuscular or other appropriate glucose routes. Next, seizure made easy. Think, protect from the injury. Do not put anything in the mouth. Do not restrain convulsions. Give oxygen. Recovery position after the movements stop. If convulsive movements last 5 minutes or longer or recur rapidly, urgent ambulance help is advised. Memory hook. Fit, protect, don't pry. That one line saves a lot of mistakes. Next, asthma made easy. Think, wheeze, breathlessness, inability to complete the sentence in severe attacks, exhaustion, confusion, decreased consciousness in life-threatening attacks. Most dental chair attacks respond to a few activation of the patient's short-acting bronchodilators such as salbutamol. If the patient does not respond rapidly or severe features are present, urgent transfer to the hospital is recommended. First aid guidance also supports helping the patient use a prescribed bronchodilator. Memory hook. Asthma is equal to inhaler first, ambulance if failing. Next, angina or myocardial infarction made easy. Think, chest heaviness, tightness or indigestion like discomfort that may radiate to the neck, throat, arms, back or upper abdomen. In the dental setting, guidance recommends sit the patient upright if possible. Give GTN if not already taken. For sustained severe cardiac pain or MI suspicion, give aspirin 300 mg and call for ambulance help. Memory hook. Chest pain is equal to sit, spray, aspirin, summon, help. Next, anaphylaxis made easy. Think, sudden onset, rapid progression, airway, breathing or circulation is compromised. Usually skin or mucosal changes are seen, though these may be absent in some cases. The first line treatment is intramuscular adrenaline, epinephrine given early with emergency response getting activated. Resuscitation guidance stresses A, B, C, D, E assessment and early IM adrenaline. AHA first aid guidance also states that epinephrine is the main immediate treatment and EMS should be activated. Memory hook, anaphylaxis, adrenaline first. Next, choking or aspiration made easy. If aspiration occurs and the patient can still cough, let them cough. Guidance says to allow the patient to cough vigorously in aspiration, and if the patient is choking but conscious, encourage coughing. If they cannot cough efficiently, give sharp back blows. Symptomatic aspiration of large objects need urgent hospital referral. Next, the easiest NEET MDS chairside emergency map. Flat patient, think syncope. Sweaty, shaky, confused, diabetic, think hypoglycemia. Wheezing, can't speak properly, think asthma. Chest tightness radiating to the arms or to the throat, think angina or myocardial infarction. Fits, Jerking movements, think seizures. Sudden allergy plus airway or breathing or a circulation problem, think anaphylaxis. Can't breathe after the object or the material, think choking or aspiration. Oral chant. Eyes 4, voice 5, motor 6, 13 to 15 mild, 9 to 12 moderate, 3 to 8 severe. Faint, flat. Low sugar, glucose or glucagon. Asthma, inhaler first. Chest pain, GTN, aspirant, call for help. Fit, protect, don't pry. Anaphylaxis, adrenaline first. Choking, cough first. Hope that helps. Don't forget to save it. Don't forget to share it. Let everyone benefit. Take care.